All right.
And welcome, everybody. Good afternoon. Welcome to the Emory MCI Dementia webinar series, which is hosted by the Emory Cognitive Neurology and Integrated Memory Care clinics. My name is Alice Cooper Salisbury. I am a licensed clinical social worker in the Cognitive Neurology Clinic. I am joined by my colleagues, Ashley Varner and Debbie Arnold, who are both licensed clinical social workers also. Today, we are going to have this webinar series that also, I got lost. We are going to have this webinar series that is based on topics that you have provided to us through different sessions and us talking. We hope that you will be able to ask questions in the Q&A box. This is a webinar, and so you are not on camera. The participants are not on camera, and your mics are muted. So please put your questions in the Q&A box, which should be located at the bottom of your screen. If you have any other topics you would like for us to discuss, please feel free to also put that in the Q&A box or send an email to Ashley, Debbie, or myself. And so I will turn this over to Debbie.
Hi, I'm Debbie Arnold, and I'm the social worker in the Cognitive Empowerment Program. And I'm thrilled that Leslie Cecily has agreed to join us. You're in for a treat if you have not had an opportunity to hear her speak before. Leslie is a dually board licensed psychotherapist in clinical social work as well as marriage and family therapy. She is the owner of a community-based psychotherapy practice in Decatur, Georgia. Cecily Counseling Services specializes in older adults, dementia caregivers, and their families. And Leslie is known for being knowledgeable and passionate, working with families, individuals, and couples who face neurocognitive disorders and dementias. She provides solid and systematic based comprehensive psychotherapy tailored to her clients' unique needs. She completed her graduate studies in social work administration at the University of Pittsburgh, and she completed her residency in marriage and family therapy at the Link Counseling Center in Sandy Springs. She has been recognized by the Georgia Business Journal and is a recipient of the Best of Georgia in 2022 and 2021 in counseling, addiction, and mental health. So please join me in welcoming Leslie Cecily, LMFT, and LCSW.
Well, thank you so much. I really appreciate having the opportunity to speak with you all today. I thank you, Alice, Debbie, and Ashley for facilitating this webinar series. And again, I appreciate your partnership as well, in that I know that we have been able to share resources with each other in the past. So I'm grateful for meeting with you all today. So thank you, everybody. My name is Leslie Cecily, and my hope today is just to really provide useful information about the benefits and challenges of family and individual therapy. So my hope today is really just about giving information, hopefully answering questions that you all may have about this topic, and we'll just go from there. So just a little bit about me, again, and just a little bit more about the practice. I'm going to try to open this. Hopefully it'll do what I want it to do. For those may or may not be familiar, I'm just going to give some information about counseling services. So I am located in Decatur, which is not too far from Emory DeKalb Hospital, which DeKalb Medical Hospital, when I'm used to referring it to. But really, my practice specialties are dealing with issues related to anything between mood disorders, anxiety disorders, neurocognitive disorders. So a lot of folks that I do see are dealing with that for themselves or family members that may be dealing with that. Intergenerational issues, caregiver burden and stress. And so I really specialize in this niche of dealing with families that are dealing with neurocognitive disorders, couples that are dealing with it, as well as individuals who may be caregiving for those who are dealing with it, or those who are just recently diagnosed with that. And so if you have questions for me later, I'll give you that information about where to contact me, but my information is here in this handout. Uh-oh, did I do something wrong? Let's see. Hold on.
I think you can just go back to your PowerPoint.
Go back to the PowerPoint. I told you me and Zoom are almost earlier is that I do want to provide information on the importance of mental health care for MCI or dementia families, because it is a unique challenge. There's unique mental health needs for this population, as well as give more information about family therapy and individual therapy and the benefits and the drawbacks from receiving care for mental health. So I want to talk about when is the right time, right? So how do you know when it's time to seek therapy? So I want to talk more about the indicators for therapy, understanding what that looks like. So my main thing is when MCI or dementia brings, right? When it brings increased frustration, when symptoms are becoming more difficult to understand, when it brings difficulty talking to family members, when it brings anger and resentment, when anger and resentment is more frequent, when it brings guilt, specifically about like the limitations that you're providing adequate care, or really when you're wanting distance, right? So when you're wanting distance from yourself or from the person that has it, right? So some of these things are, when you're thinking about the uniqueness of it, it's really when this thing brings, when MCI or dementia brings this, right? You want to consider, if I'm dealing with this, then maybe I want to consider therapy. Here's some other indicators. So there may be indicators if you're feeling helpless. So when family members you're having difficulty coping with the demands of life, just your daily life, just feeling drained every day. So everyone feels drained once in a while, but if it's a consistent thing, if it's more than 2 weeks, then you might want to consider like consistency, right? When it's consistently feeling that way. When your emotions like anger, fear, or sadness become uncontrollable. So when you're having those intense emotions, when it's difficult for you to even communicate, when family members or yourself feel trapped, right? So you may feel trapped that, hey, this won't improve, or I'm stuck, or this is bad. This is a worse situation, or it won't get better. These are indicators that it might be time for therapy. Other indicators are about difficulty functioning. So you may, again, like I said, maybe dealing with the struggle to complete daily tasks or responsibility, but also it's about that lack of energy or feeling tired, or even when you sleep, you still feel tired, right? Not having enough downtime. And again, withdrawal, when you feel that you are not engaged. Some people may feel like I don't do much anyway, but there's a difference between being inactive and just feeling withdrawn. And so those are kind of key indicators that it might be time for therapy. Also, when you're having extreme emotional reactions. So excessive anger, we'll talk more about that as it relates to grief maybe, but when family members are expressing, or when you're expressing disproportionate anger or rage. When you have extreme fear, right? So then there's maybe, again, fear where it may not be appropriate, right? So they're not normal reactions to just certain things to be afraid of. Persistent sadness and severe depression. That may look like, again, loss of interest. You have changes in your sleep or appetite. You may have thoughts of, well, what's the use? Should I even be here? And those things, again, are key indicators to look for or to seek out therapy. Having communication breakdowns. So there may be difficulty expressing your feelings, whether it's with people who you have spoke with before or just with your family members, or even period, just with yourself. You may avoid conversations, avoid difficult conversations, not pick up the phone when people are calling. And also ineffective listening. So when you have yourself or family members who you feel that are not listening to you, that you feel like you're not even being able to understand different perspectives of the circumstance that you're in, that also may be an indicator to seek professional counseling. So I'm sure that you all have spoke about caregiver burden, but it's also something that is a key indicator as well. And so some things that are unique to it is that sometimes caregiver burden provides that notion of neglect and overwhelm. So neglect of self sometimes, and also a consistent feeling of overwhelm. And that behavior may look like not sleeping right. Again, being withdrawn, sleeping too much or not enough. Sometimes it may look like other habits like drinking or going back to old habits that you haven't picked up before, like smoking or things like that. It may also look like depression. So having irritability, hopelessness, helplessness, anxiousness, all of these things can look like common signs of caregiver burden. That too is an indicator to seek professional counseling. I want to talk about some of the unique needs for couples therapy with dementia and MCI families. And so there's two different examples I'm going to give. So the example may be whether you are the spouse of someone or you are someone like, for example, the daughter who is married that needs couples counseling, that's caring for someone, right? So caregiver role may be shifting, right? So as a spouse, you may see that your identity may be shifting more into the caregiver as opposed to husband or wife or our partner. That may be something to start to maybe seek couples therapy. Communication issues about grief and loss. So some couples may talk about grief very differently. So let's say if a diagnosis is recent, but you're still able to talk about it. Grieving is important as a couple to do together. And so having communication about grief and loss is definitely needed. And particularly if you're not on the same page of how you are perceiving the loss. If resentment and frustration is also present, so let's say if the partner is feeling resentful of having to do care or something is shifting in that, that might also be a need for couples therapy. Dealing with intimacy issues. So intimacy will change with this, but having the space to talk about that and how that's impacting each person in the couple, that is helpful to know. And that's also a need to maybe seek couples therapy. On the other end, if you are a family member that's been impacted, but you are in a relationship and where that's impacting the relationship that you're in. And so I've had folks who may need couples therapy in their own relationship regarding a family member that has dementia. So They may feel a lack of support from their partner about what's happening. They may feel misunderstood about the stress that's related to dementia or MCI. Coping with the behavioral changes that they may be caring for. So being able to know how to communicate with their partner about that if they are the main caregiver. And again, just it's high levels of stress, right? So just knowing that having couples therapy can help address those high levels of stress when that person is doing more of the caregiving in that role. There are limitations in seeking therapy. And so I think since COVID, things obviously have changed of how psychotherapy is implemented, right? So we have obviously teletherapy versus in person. And some people only now do teletherapy. Sometimes it would have been just solely in person. And even with that, there was limitations with that if people couldn't get transportation. Where to search for therapy. So even where to start. Do you start online? Do you even know where to go? Are you getting good referrals for that? There's that. Finding a therapist that has the expertise in this dynamic. Do you know that any therapists that understand MCI and dementia? Reportedly, about 2% of marriage and family therapists are trained with this or even have a knowledge of understanding how to provide therapy for these families. And so knowing that that's a limitation. Knowing that your therapist will be a good fit for you. And so sometimes it may take a few tries to see if that therapist would be good. And that's, dealing with costs and insurance, right? So if you have to do that, cost and insurance can be an issue. And then sometimes there is waiting lists for a therapist. And so just understanding those limitations when you are seeking out therapy, you may expect that, particularly if those folks do not specialize in this area. So now I'm going to talk about the benefits, approaches, and drawbacks in seeking individual, family, and couples therapy. Just quickly, I want to talk about the principles of family therapy. And so if you're not familiar with family therapy or what that's like, most of us either have been in individual or couples therapy, possibly. Doing family therapy is different. It's unique in that it has a different approach and how the therapist will sit with you. And so I want to talk a little bit about that. So family therapy is a type of psychological counseling that focuses on the family as a system. And so when I'm sitting with a family, I don't see them necessarily just as the impact of the individuals only. I look at that as an entire system. The family actually is my client. And so when I do that, we're dealing with more of the patterns of interactions and the relationships within the family unit. And the core principles of family therapy view the family as an interconnected system focusing on patterns and dynamics rather than individual issues. And so my goal would be then to correct any of those interactions, patterns, communication issues, all of the above around the family as a unit. And so my role as a therapist, excuse me, would act more as a facilitator. I may also act as a joiner. So I actually may, quote, join the family. So sometimes I may fill in as a member and communicate that way to understand how their processes work. My goal is also to help family members communicate more effectively, identify challenging patterns, problematic patterns. And then the role too is to help facilitate objective goals and therapeutic goals. And again, my role too is to remain neutral. I want to also just quick note, also to define a little bit of difference between a mediator and doing family therapy. And mediation, sometimes if you see a registered neutral is what they call it, or a family therapist. One of the main differences is that a mediator does look at having a neutral stance, but a therapist will go deeper into the issues and patterns of the relationship and help more of a long-term stance. Mediation sometimes looks at, what the issue is, and it's a very short-term act for doing that. But both a family therapist and a mediator will be quote unquote a neutral party in their process. So I want to give a case example of what this may look like, right? So I'm going to use this case example throughout this webinar. I'm going to reference it, and it'll make sense as I go along, but I want to talk more about how a family can, receive individual, family, and couples therapy. So I'm going to give a case example. So I'm going to read it. Hopefully it's not too lengthy, but you'll get the point. So Jason is age 45. He requested family therapy with his sister, Stacy, who is 42, and mother, Kate, who is 72. Jason wanted to have therapy with his mother and sister about where she needs to be living and about her depression. Currently, she lives alone with her twin sister, who has an anxiety disorder and does not leave the house. Kate's husband, William, who's 75, has been diagnosed with Alzheimer's and recently moved with their daughter, Lisa, for the past year. His move was due to Kate's emotional outbursts and inconsistencies with his care. Lisa, 35, is married and pregnant with her first child. Jason expressed that Kate is forgetting. However, her physician assessed this as grief. Kate believes that she is fine and she does not need further conversations about her care or memory. Jason is recommending that she move with Lisa. Lisa and Jason haven't spoken in over 6 months due to a disagreement about what's going on with their mother. So let's talk about the advantages of family therapy. So in family therapy, in this situation, you would find that the goal would be a shared responsibility and an intergenerational understanding. So bridging the gaps and fostering empathy for understanding dementia is important in family therapy, and also just a distribution of responsibilities. So reducing burden in one individual to prevent burnout would be that goal. So these are some of the advantages of doing family therapy with MCI and dementia. Also, excuse me, providing a supportive environment. So as a therapist, being able to support all of the family members and creating that network for that person or for the family members is important. And also enhancing improved communication for allowing better coordination and understanding of what their plan of care would be. There's some drawbacks with family therapy. Family therapy certainly brings up complex family dynamics. And so managing different personalities, understanding that that's going to come up, there's going to be tension, pre-existing conflicts can come up, resistance to participation. And so some family members may be reluctant to engage in therapy or creating barriers for treatment. That certainly happens. And it's up to the therapist to deal with that and or address that accordingly. And sometimes it's about joining the family in order to do that. Time and scheduling. Sometimes if you have family members, it's hard. It's hard to schedule. It's hard, particularly if you have folks who are in different locations, right? And logistically difficult to do that. Something else too, confidentiality concerns. So sometimes, I've had folks who may not want to talk in session because of who is present. And so it really takes some time in order to figure that out of how to deal with that. Whether you have to have separate sessions or do things of that nature to figure out what some of the privacy concerns would be. again, emotional intensity is there. And yeah. Some of the family therapy approaches for MCI dementia families look like this. And I'll share some of these tools later, and what they look like if we have time. But it is a systemic family therapy, right? So again, a therapist may help figure out the patterns that are dysfunctional and recreate that system to where it can function better to homeostasis. And so, in a family therapy session, you may have some therapists doing a family history, getting more narrative about what the family traumas have been, what has it family experienced in the past, how have you gotten to this point. One of my main statements is that this all didn't happen in a vacuum. So all of the issues that we're dealing with didn't just happen because someone was diagnosed with MCI or dementia. These patterns have been, and now we have to deal with the patterns with this situation. And so getting a a genogram history, I'll show you what that looks like later, but getting that information is imperative. Some other things that look for therapy approaches, we may do some structural and or strategic family therapy. And so sometimes it's necessary to understand how to know like where the blame is coming from, or what's the hierarchy or the alliances in the family. And some of these patterns can, if we restructure the family system in that way, it helps alleviate the stress and the burden within that family system to where now we can talk about what is happening. Now we can really alleviate some of the strain to talk about what are the next steps for dementia care families. And I think I mentioned this before, but sometimes I will be in an enactment with a family. So I may take on or model the role of a family member to help them understand their way of engagement and to see how to alleviate that so there's less problems arising in this. So in that case example that I shared, and again, I will continue to reference it. So in that case example, the need for family therapy is there's family conflict, right? So there is a need for a united family approach to address Kate's current and future needs. But there's also a strained relationship between Jason and Lisa. Those are the two siblings. And they have tension about Kate's care. So in a family therapy session, I would talk about those things and understand how to alleviate that. And I may approach it by discussing their family narrative. How did they get here? Another point of mention for approaches is that I would also provide maybe some time to support Kate, right? So there's necessary for grief counseling and strategies to help her manage her depression. That's also things I would bring up in the family session, but also talk about what that would look like for individual therapy, which I will talk about a little bit later. And also developing a plan that considers Kate's wishes and the family's concerns. So I would talk about both and how they may be in conflict at the moment, but also I would organize joint sessions. So I may separate family members and talk specifically to them and seeing how improving communication and resolving conflicts together could work. But I may have to separate family members to get that honesty understood and what is happening with them. And also conflict resolution. And so I may facilitate a session with Jason and Lisa, just with them, to address their estrangement and disagreements about Kate's care. So let's talk about advantages in individual therapy. So individual therapy can be also intensive work, but that could be an advantage, right? Because we're looking at what's happening with you as an individual and dealing with a neurocognitive disorder with yourself and or with family member. And so issues dealing with grief and loss is imperative because there's something that is changing, and it's something that's changing that you may not want. And so if you don't want that, I wish this wasn't here, I don't want to deal with this, that's a grief statement. And so dealing with that is important in individual therapy. And also dealing with new relationship roles. In other words, who are you now that you're dealing with a neurocognitive disorder? Who are you now that your identity, I say caregiver identity, but also sometimes it's care receiver identity as well. How do you then deal with that identity as yourself and in your relationships? Individual therapy also has the advantages that is a dedicated time and attention to you. And so your personal issues, past traumas, complex emotions will all be dealt with you. So I consider therapy as a space, as your space, where you are able to use that space as your time and how you get that done. When it's done in an effective way, validation and compassion will be there for you, and it will be able to give you that motivation to at least understand what do you need to do now. So validation is truly what an advantage in you may not receive validation in other parts of your life, but you can receive that in individual therapy. Individual therapy also empowers you, it can empower you to take an active role in your mental health. And so as you're doing that, you may start to notice that you are now putting your mental health as number one, right? So doing great self-care. It is a part of self-care, doing mental health or doing individual therapy. And then also having a sense of control and self-determination of how you are engaging in your life. Another thing too is that I think some other advantages would be flexibility. And so individual therapy, obviously, if you need to reschedule or if you need to cancel or whatever, it's easier. If you are doing that with other people, sometimes it's not. And then confidentiality is just because it's one-on-one, it's easier, I think, around how to openly express your emotions and thoughts because it's just you. And as opposed to maybe doing it with another, depending on your relationship, some people may feel a sense of holding back. And that's, again, up to the therapist to facilitate that. But in individual therapy, that can certainly not, that's an advantage of being one-on-one. There are some drawbacks in individual therapy. So, you can be isolated. So if you're dealing with a person who is experiencing MCI or dementia, you may feel really disconnected in that because it's just you, right? So you're dealing with other family members or you're feeling the weight. And so going to individual therapy may sometimes have that sense of isolation or aloneness in that. Again, that's where family therapy or couples therapy can be of help. Also, you may have the therapist and or yourself may have a limited perspective at first. So without the family context, individual therapy may miss important relational dynamics and interpersonal issues that can be better addressed in a family setting. And kind of what I said earlier about the isolation. So the burden of care. So that heavy responsibility can be reinforced sometimes if you do individual therapy. It may feel like you're the only one who's dealing with it. And so that is some things we work through in individual therapy. Some other drawbacks of individual therapy, getting respite. So if you need respite care, I've had many people have had to cancel, whether their person that they were caring for was having a bad day, right? So that's a drawback. So having backup for yourself can be, depending on the therapist, cost. So if a therapist does not accept your insurance, you may have to come out of pocket for that. So that can be a drawback if you're not able to do that. I'm not sure why I put privacy, but But yeah, so those, I think those are the two main for that. I would cross out privacy. I don't see that as a drawback. Individual therapy approaches for MCI dementia persons. So I want to talk a little bit about what are some approaches that are helpful with MCI dementia persons or families or as individuals. So psychodynamic looks more like going into specific, it may look at your past, but it does specifically speak on your own issues, your own going deeper in your past, going deeper in what are some challenges that you may have, some of your traumas that you may have, and how they impact your daily life. Grief counseling looks like just that. So it looks like dealing specifically with the loss and how to then move on and what life looks like now that this is happening, and really dealing with the stages of grief and understanding that anger and depression and wishing it wasn't here, all of those are normal parts of grieving. So really normalizing that, but also counseling through how to go through it so then you know how to function with this new narrative. Cognitive behavioral therapy is another approach. Cognitive behavioral therapy looks more like changing your thoughts to then change your patterns and behaviors. So really thinking about old thoughts, excuse me, unuseful thoughts of thinking, what do we need to do to change that? Short-term therapy solutions are solution-focused therapy. So sometimes it may look like individual therapy may look like doing really specific goals and having homework. I may do that in order to get that done to keep that person moving into what goal that they specifically had. And sometimes it's just, I want to not be so stressed. So here are some specific short-term solution-focused things that we can do to get that done. Even though systemic focused is looked at for family therapy, systemic focused also, I can do that with an individual because again, you're not in a vacuum. And so I look at what other relationships that you have that may impact how you are relating to yourself and or the person with MCI dementia. And then caregiver identity is a big one too. And so I usually talk about the identity of caregiving and the parts of you that are caregiver, the parts of you that may be a daughter, the parts of you that may be still a wife, like how does that conflict, what does that look like? And talking about caregiver burden and where they may be with that. And so with the case example, going back into individual therapy, so what does individual therapy, what would that look like in that case example? And so specifically looking at Kate's depression and grief and Kate's depression and grief over William's condition. And so talking about Kate of how his Alzheimer's has impacted her. What does she understand about her depression, about that? What happened with her as she was caring for him? So those are some things that I would maybe talk about if I was doing individual therapy with Kate. Also talking about what her thoughts are on her own cognitive decline. Is she what are some things that, she feels that she's resisting? So I would talk more about her grief and loss in that. And then also, knowing that her living arrangement, so she has a twin sister that is feeling that has mental health issues. So what are her thoughts on that? Does she have any concerns about her living situation or not? And if she feels like her situation if she needs to move, what are the things that I would talk to her about, what her future goals are for herself. I would also speak about Kate's reluctance, her ambivalence, again, about her own cognitive decline, if that's what's happening, and or if she has grief, we can work on that, and also emotional issues that create a barrier to effectively support her And so there may be some other issues that she has with her children that I can specifically speak on for her. I want to talk about how couples therapy can be useful. So I did speak a little bit about where, what are some key indicators that couples therapy is needed. But then I could also speak on how couples therapy can be helpful. And really, I would say that it really just helps couples understand how to respond to each other emotionally. And so it also helps understand undesirable behaviors of interaction. And so let's say if a spouse is asking for help, but a spouse then, if you will, distances, then I would help both of them, be present and respond to each other. But again, because patterns of interaction don't just happen in a vacuum, I would really talk more about how that as a couple, this pattern has been created and what their understanding of it is. I would also help shift the blame to historical and negative patterns of interaction. So I would just kind of shift it and to say, this is just your interaction. It's not necessarily the blame of this person or that person. It's just how you all interact, and let's see how we could better adjust in dealing with what's happening now with MCI or dementia. And so seeking emotional safety for the couples is important, making sure that couples feel safe in doing that, and helping the one who may be distancing or the one who may be really approaching the other, helping them do that in a way that is skillful and less stressful. So there's some approaches that are helpful with MCI dementia couples. And so I did kind of a little bit talk about emotionally focused therapy. And so emotional focused therapy does look at turning toward your partner as opposed to turning away from them. And that's more about increasing attachment with your partner. And then also, Gottman is a good method for couples with MCI and dementia. And it really looks at some of the key indicators of successful relationships. For example, still understanding, as this couple is growing still, right? What are some of the things that you do for your partner that you know that they love, right? Are you admiring them? Are you providing words of affirmation? These are some of the principles of the Gottman method. And then also avoiding some things that is called the 4 horsemen of apocalypse. So that looks like, making sure that you don't stonewall your partner, right? Like not communicating with them or blaming them, right? Those are some things that that the Gottman principles talk about, and I help couples achieve that in dealing with MCI dementia still. Again, going back to systemic focused therapy on grief. So again, looking at how this couple is dealing with grief as a whole, and how have they dealt with grief in the past or loss in the past, and figuring out how to help them increase their connection as they're going through this phase of their couple. There are benefits of doing couples therapy, right? So there are socio-psychological benefits of doing couples therapy. And I think in this, I was more focused on really how having a partner can help going through this, or having someone that is consistent in your life that really supports you. And so there's social engagement that's positive. There's social interaction, right? So marriage connects individuals with a wider social network, fostering greater social integration. So having that kind of social component to this, supporting the couple to make sure that that is happening, these engagements happening, can help the person who is dealing with cognitive decline. That can be helpful to them. So it is important to strengthen your partnership, strengthen your couple if you are in one, so that these things can be beneficial to you. I'm going to skip this slide, but this is also just kind of talking more about what are some of the resources for being in partnership, but I'm going to skip this slide. I don't think this is resourceful, so I'm going to skip that. So how do you know therapy is working? So you know therapy is working if you are experiencing less stressful communication, right? So if you feel less stressed, if you're kind of being able to communicate easier and you're doing therapy and you're getting that done, it may be working. Did you learn a new skill? So are you able to understand what those things are, and are you able to apply them outside of the therapy office? If you're doing that, then therapy might be working. What are your friends and family noticing? So sometimes clients may say, you know, my family has noticed that I'm easier to talk to, or I am not expressing a lot of irritability. Then it may be working. Therapy may be working for you. Are you saying you feel better, right? So what are you reporting? And if you're saying I feel better, then you can talk to the therapist about it and see if you need to continue on that path or that journey that you all have established, or it may be you may be finished with therapy. It just depends. But again, you know, you could always discuss your goals with your therapist. So let's talk about some case examples of what can be accomplished in therapy. So I've talked a lot about communication. And I think also some of the things that also can be explored I didn't discuss. I think resolving family conflicts is important. Not all conflicts will be resolved. However, it can be accomplished, right? So family healing, I think, can happen. I've seen it happen in doing this. Sometimes having this happen in families, being diagnosed, having a family member diagnosed with MCI or dementia, it can be a catalyst for families to change how they operate, change how they communicate with one another. And so it can be done. Discussing living arrangements was also part of the case example. So it provides open communication again with long-term goals for families as they deal with this, and or also as they age. If you're experiencing this in later life, then having these kind of conversations can be accomplished with doing family therapy. How to know when therapy is working. So again, going back to that, I want to share some things that you can do at home, whether you are wanting to seek therapy or wanting to see if you're improving. There's a couple of, you know, measurement tools that you can actually self-administer. There's a PHQ-9, which is the Patient Health Questionnaire. Let me see if I could pull it up. This is a really good, you could implement it yourself, but it's a good tool to ask your therapist to do with you, or you can do it yourself. But it can be used for just at least screening for depression, or looking at these questions. Are you feeling down, depressed, or hopeless? Do you have little interest or pleasure in doing things? To see where you started with therapy and seeing if you improved, these are good measures to have for yourself. And this is also within the past 2 weeks. So when you answer the questions, you answer it in understanding that have you done these within the past 2 weeks?
Leslie, it's great to know that these resources are readily available and that our audience will have access to them. I do think we might need to leave a couple of minutes for questions and discussion rather than clicking into the others.
Okay. Yeah. No problem. But these are just references if folks want to have it.
And I think they're really helpful. It's really nice to have a way to, oh, let me put my camera on. But Leslie, were you done with your presentation? We don't want you to cut it short. We're just.
Oh, sure. Sure
Um,
thing.
So
Um,
audience, please feel free to put questions in the Q&A. Leslie, what an incredible presentation. That was
Oh,
just
thank you.
phenomenal. Thank you. And
Oh,
thanks for
great.
the specifics about family versus couples versus individual and how they can be beneficial. I know one question that came to me was something that we struggle with here is, how do you determine when a patient living with dementia is no longer appropriate for individual counseling or even family counseling?
Yeah. And so I think there's a couple of things, right? So it depends on, let me just be clear. So are you asking for yourself as a social worker, like or is it just
I think
people who are
I'm just
referring?
curious
Yeah.
how you make that call for yourself to help our audience know when they would want to
Yes.
seek this versus when it's really not going to be productive and potentially not
Understood.
paid for.
I think that when there's a couple of things when they're not able to attend, right? So the attention span is low, irritability, because really, if I'm honest, I mean, there's moments where I've dealt with folks who have had progression, right? So let's say if they had early MCI diagnosis, but then it started to decline, I will talk about that. But you can notice that. Or for those who are wondering, should I make a referral? Sometimes it's for themselves or maybe even for another. I'll talk about that as well. Tell me a little bit more about, how you're able to sit. Do you have, are you able to have any insight? Sometimes insight may be lacking. Sometimes if it's like that, having another person there, because if we're talking about grief and loss or we're talking about doing couples work, then we can do that together, but it may be short term. It may be something that may not be an extension. It may be 1 or 2 sessions, and then continuing on with maybe the caregiver about their work in that. So I don't think it's a straight answer, but I think as a therapist, I'm able to understand if somebody is not able to attend or have insight, and if it has progressed, or we can configure it where at least there's some sessions where we can do that. I've had folks who've come in as a family, and then the husband may have been diagnosed, and we did it as a family. He was able to attend a little bit, but we maybe did about 3 sessions, and then the kids and the spouse, we had sessions around that together because he wasn't present.
That's really helpful. Thank you.
Leslie, if a person who has been diagnosed with a neurocognitive disorder, even mild cognitive impairment, is having a lot of difficulty sharing this with the people who love them for various reasons, is your office or a therapist's couch office situation a good place to try to bring in adult children or siblings and or get some guidance toward that? Is that a reasonable use
Absolutely.
of therapy?
Yes, absolutely. And so individual therapy would be the first place, right? So to my understanding, you're saying if someone was recently diagnosed or has a neurocognitive diagnosis and they're afraid to share it, is that what you're saying?
Maybe not afraid, but for various reasons, sometimes concerned about the impact on other family members, sometimes, really not wanting to add stress to a family system, or, for various various reasons, we hear a
Mhm.
real reluctance to kind of share what you're dealing with, that this is my health
Understood.
information, it's private, I don't
Understood.
I
I
don't feel
would deal with it right
comfortable.
there. Yeah, I would deal with it just right there. I would start there,
Mhm,
right? So I would deal with that right there. I wouldn't force the issue of having them share,
mhm,
right? We may get there, but I would deal with that issue where they are. There's, there's
mhm,
history behind that.
right,
And so I would really get into that first before forcing the issue of, no, no, you need to share, we need to, right? Unless there's like specific harm, like if there's harm there, then I
mhm,
would certainly, address that. But
mhm,
if it's something that isn't immediate concern around safety, um, I would start there first.
mhm,
Then I would then incorporate the possibility of what that looks like. And it may look completely different. It may look like having other different supports, or it may have a situation where, we develop something else, right? It may not look like that.
mhm,
But I would certainly start with they are, but I wouldn't, unless there's um, a safety concern, I wouldn't force the issue, but I would certainly talk about what the reluctance is, like what's happening with them
mhm,
in that.
mhm.
Another
Thanks.
question that came through
Sorry.
was how much difficulty this person has found somebody has had in
Sorry.
finding a therapist
I'm sorry. I'm pressing buttons and
to accept who accepts Medicare or works on a sliding scale. Do you have any hot tips for folks who are familiar with mild cognitive impairment and mild dementia and seeking therapy?
so I'm going to just say, here I am, right? Yeah. So there are, when you go to like Psychology Today, you obviously can do that. But you really do want to ask them, what is your experience with this issue? What is your experience with neurocognitive decline, right? What is that? Because some therapists may say, well, I know how to deal with families. I've done that before, but it is a specific dynamic that you need to understand. And um, it's not fair for someone to sit through that and not really having that connection and understanding what are the dynamics and what questions to specifically ask. So I would go to Psychology Today. I would go to, if you know a therapist, you could always ask them for a referral. Um, Therapists in Georgia, some of them are connected with GTN, Georgia Therapist Network, and they could provide a paragraph and say, hey, I'm looking for this type of therapist. And that may be another clue, another help for that. But yeah, but like I said, 2% of marriage and family therapists are trained in this. Social work is different. We're a little bit different in that, but not all of us are psychotherapists in that regard too. So it's just, there's lots of work to do.
Thank you. We have time for any last questions from the audience. All right. Well, I'm not seeing any questions. So Leslie, any more questions? Leslie, thank you so much. This was incredibly informative. Already had a couple of participants text me about how helpful it was for them. So really appreciate it, and we'll be in touch.
Well, thank you. Well, thank you. And it was so nice to again see you all. And Jenny, I see you up there, and so I certainly have heard your names, and it's really, really good to put a face to the name. Yes. So I
Back at
appreciate
you.
you guys.
It's so nice. It's so nice to engage with you, and thanks for doing this today. You did an amazing job.
Absolutely.
Thank you, Liz.
Absolutely.
Thank you.
Take good care.
Bye.
Bye-bye.